Hello and welcome to LociMania Emphysema. The definition of emphysema is air space enlargement, and this because it happens because of alveolar wall destruction, and this is because you have a phenomenon of air trapping happening inside the alveoli. So it's very easy for you to inhale the air and oxygen, but it's very hard for you to exhale. The air trapping occurs and the air is stuck inside. The symptoms to emphysema is dyspnea, weight loss, and cough with minimal sputum. So trouble breathing, weight loss for no reason, and cough with minimal sputum. As we go on to the next slide, I'll show you the four types of emphysema and the causes of these types. So here you can see centroacinar, irregular, panacinar, and paraseptal. These are the four types of emphysema. And you memorize them by memorizing this easy sentence up here, which is cigarettes is primary problem. So cigarettes, C for centroacinar, I for irregular, P for panacinar, and P for paraseptal. CIPP, CIPP, as you can see. And going on to the next slide, I'll show you how to memorize the four causes to these four types by memorizing the same sentence up there. So cigarettes is primary problem. Very easy. So centroacinar hits the central parts of the lung, and you can see that it's commonly caused by the cigarette smoking, and that's the most common type of emphysema. Our irregular emphysema hits irregular parts of the lobes in the lungs, and it's caused by eye inflammation, heel to scarring, and it's very much associated with fibrosis. Then you have the first P, so that's the panacinar in the primary, and panacinar is caused by protease inhibitor deficiency, which is a rare genetic disease, also called alpha-1 antitrypsin deficiency. So this is how you memorize the first P with the panacinar. So primary with the panacinar is by memorizing that the pan has an an in the antitrypsin. So pan and an. Memorize that, and you memorize the first P is primary and panacinar emphysema. And lastly, we'll have the last P, which is problem, and cigarettes is primary problem. So the last P is paraseptal, and that's associated with pneumothorax. So once again, I'm going to show you that panacinar is associated with the antitrypsin, so alpha-1 antitrypsin. So by memorizing that the third word, which is primary, the P, has an antitrypsin, and the panacinar has an an. So pan, an. Remember that, pan, an. So that's how you memorize the primary is with panacinar and antitrypsin. So now we move on to the diagnosis and treatment, and I'll show you how to diagnose and how to treat. So first of all, you have CT scan, a blood test, and spirometry in diagnosing. CT scan mostly used for the surgeon to see if you need any kind of surgery. A blood test to check the oxygen and carbon dioxide levels in the bloodstream. And then you have the spirometry, which is the most important one diagnosing this disease, because it checks if it's restrictive or obstructive disease in your lungs. Also not mentioned, you have a chest x-ray, which checks for any kind of differential diagnosis, so you have to rule out any other disease. Coming to the treatments, you can see that the treatment is uncurable. So this is just sad to see right now, but that's not the end of the world, because you have bronchodilators and inhaled steroids as a relief to the symptoms, and then you have, in severe cases, surgery or lung transplant, because this disease does not, the lung tissue does not regrow, does not grow back. So the tissue will be damaged forever. So in some cases you will have to do surgery. The surgeon will go in and cut off some of the destroyed tissue and damaged tissue for you to breathe easily. And then there you have the lung transplant as well, which is another way, but this is only for some special patients that will be able to go through the surgery, and then as well have to be careful after the lung transplant, because they need to live on immunosuppressants for the rest of their lives in order to let their body accept these new lungs. Thank you, that's everything.